Now that we're a year in, we have to also consider some of the non-communicable diseases, the chronic diseases that any population has to have addressed. Diseases such as diabetes, such as high blood pressure, and they're the diseases we're really going to have to deal with. Around 60,000 women in this camp are pregnant, and we know that the Rohingya population tends to want to deliver their babies at home. So we can expect that there's going to be obstetric complications, obstetrical difficulties, so real issues around reproductive and maternal health, real issues around child health. Now, specifically for this population, we also know that many of them were injured in the violence that led to their flight, physically injured. We also know that many of them must have, although we don't have great data on this yet, they must have mental health problems, because we know that many of them have gone through extremely traumatic experiences. They've seen family members and loved ones killed, maimed, or injured, or gone missing. So when you look around this camp, as we drove through it today, a few things strike you. I mean, the first is the sheer number of people. I mean, this is a highly dense population, but it's also a bustling camp. There's lots of market stalls, there's people selling fruit and vegetables, there's people selling clothes. Life is continuing, and one thing that really struck me is how resilient the Rohingya people are. These people will survive, and it's very clear. I don't get a sense of despair, of hopelessness when I look around and when I talk to some of the community members, some of the people in this camp. I get a sense that people are determined that they're going to get through this and they're going to survive.